Hi, my name is Sarah Haas Taylor, and I'm a licensed mental health counselor and a board certified behavior analyst. My specialty has been working with children with autism spectrum disorders and other developmental delays. I have been a part-time DBH student since 2013. I'm approaching the last few classes of my program, and I'll be doing my internship soon. I'm on the management track, so I'm interested in developing a facility that provides integrated specialized treatment to children with autism and for the autism population in general. My program design is a behavioral intervention for children with autism addressing gastrointestinal dysfunction, or known as GID. Studies suggest that 85% of parents complain about their child suffering from chronic constipation or diarrhea. This also correlates with my observation as a behavioral health provider in my own agency, Child Enrichment Center. Chronic constipation is the most common complaint among parents and appears to elicit the most discomfort in individuals with ASD. Typically, a child will experience constipation and then diarrhea just following, and so that the main issue is that constipation leads to the diarrhea. My program intervention would be to educate and motivate parents to implement some dietary behaviors and regular exercise, and if needed, a toileting schedule to create a healthier lifestyle for their child. I believe that this will not only assist in eliminating the constipation and diarrhea cycle that their child is suffering, but it will also improve the overall well-being and physical and mental health of the child. The program would be as follows. First, I would, after doing a functional analysis and collecting baseline data from the parent, provide a program where the child would increase fiber and fluid intake to the recommended amounts, daily amounts, and logging those amounts every day, so that every 2 weeks when the parent comes to meet with me, that they will have a log and data that we can make decisions on. The child may be also taking a probiotic as recommended by their PCP to address the gut flora imbalances if present. Helping the child get regular exercise, preferably in the form of play, would also be a recommendation, and both of these two, the diet and the exercise, would need to be established individually, and ideas and strategies may need to be provided to solve some of the barriers in implementing them with each individual child. Last, I would work with the parent on setting up a regular toileting schedule. If the cause found in the functional analysis indicates that the cause of the chronic condition is that it's behavioral due to a fear or phobia, many children in the toilet training process develop phobias for bowel movements. I'd also train the parent and observe them logging the information so that they can determine whether or not there's an improvement. Some of the strategies I would use in this intervention would be to model for the parent on how to log the information on data sheets or on a smartphone or a tablet, and model how to pair reinforcement with behavior changes. I would also work with the parent on finding pairing reinforcement with the fluids and fiber rich foods. So choosing foods that they like but have the healthy attributes and meet the requirements of the program. Pairing reinforcement with using the toilet successfully and staying on the schedule could be modeled. I would also want to use positive feedback with the parent for their attempts to help their child change their behaviors, and for any progress that they make in the intervention. I'd also need to address each of the unexpected or expected barriers to treatment prior or right as they are present in the treatment. So that I can get as much information about the child's lifestyle and daily schedule, and prevent problems from occurring. It would be a 12-week program, and like I said, we'd meet every 2 weeks, and I would provide motivation. We'd do analysis of the data, and at the end of the 12 weeks, they could do another stool test and determine if there's continued imbalances in the gut. In summary, the formula for a healthy gut is pretty simple. It's fiber, fluids, and exercise, along with having a positive experience making those changes. Children with ASD are not the only individuals that could benefit from improving their health in this way. But according to recent research, children with ASD and other developmental disorders tend to suffer more medical conditions than the typical child. Therefore, it's all the more reason to help parents understand both the physical and mental health benefits a child can gain from the lifestyle changes.